and it's a privilege to follow the previous speakers and the Honourable Lady. Today's theme is making work pay. I believe this is one of the key challenges facing our country. Conservatives believe in conserving, but what is it that we seek to conserve? In a word, freedom. As Ronald Reagan said, freedom is only ever one generation away from extinction. We didn't pass it to our children in the bloodstream. It must be fought for, protected and handed on for them to do the same. And there's nothing more important to the cause of individual freedom for human beings than the opportunity to work. It's the only moral way to achieve financial security. It's the path to a better life. It's not the meaning of life, but there is no meaning in life without work. It is the force that through the green fuse drives the flower, as Dylan Thomas said. Now, God put Adam and Eve on earth to work. I believe that was a wise decision. Because good, hard, challenging, stressful and important work done well makes people happy and purposeful. It's not just a means to an end for generating taxes. The true gifts of life are to be found in the struggle on the hard road. We Conservatives are not blind to the reality of human nature. We don't pretend that people are not motivated by financial incentives. It's not selfish to want to earn more for ourselves and to work hard for it. And I believe that in the budget that was set out yesterday by my right honourable friend for the Chancellor, Mrs Thatcher would have had found much to be pleased with. In 1975, she said, "The person who's prepared to work the hardest should get the greatest rewards and keep them after tax. We should back the workers, not the shirkers. That is not only permissible but praiseworthy, to want to benefit your own family by your own efforts." And how right she was in 1975, and how right we are as Conservatives to do that now. And that's why I welcome the budget measures, especially the cut in national insurance, which will save the average worker £900 and the average self-employed worker, which we have a lot of in Redditch, £650 per year. And that combined with the changes to high-income child benefits and the childcare support that we've previously talked about, the reduction in inflation and the economy starting to turn a corner after a very difficult time, I know it will be welcomed by hard-pressed families in Redditch struggling work and home life. Of course, the welfare state and benefits are necessary in today's world. Our fellow citizens rely on us when they're sick or struck down by life's blows and they can't sustain themselves. But the pandemic has had a worrying impact, and I have seen a loosening of the links of that social contract between all of our citizens as a result. We can't ask a shrinking pool of workers to pay out of their taxes when they're working for a growing cohort of people who can't or won't work. Benefits must only ever be a last resort for those truly unable to work, never a lifestyle choice caused by faulty wiring in our system. Now, when it comes to the budget, Madam Deputy Speaker, it's quite tempting to view it as a single event. It happens over a day and there's headlines in the media. We look at it through that obsessive lens of our 24-hour news cycle and our social media feeds. But we shouldn't judge it that way. And nor should we look at the events happening in our own country as unique. We're not an outlier. Every country around the world has suffered from the pandemic and the energy crisis caused by the war in Ukraine. And I think, as my right honourable friend from Thurrock rightly said, the public are not fools. They definitely do understand and they can see what's going on. And what they can also see is that over the course of 14 years, it's the Conservatives that have made huge strides in reversing Labour's something-for-nothing culture. We have ensured that welfare is truly targeted at the people who really need it, meaning we can be more generous for those really vulnerable citizens. It was Keith Joseph, after all, who first articulated the concept of the cycle of deprivation, and he set about helping people to break out of it. And it was a Conservative government that implemented the life-changing universal credit reform so successfully being rolled out across our country. They were, of course, conceived and led by my right honourable friend for Chingford and Woodford Green. That was the true genesis of the value that work must always pay. But every time we've made reforms to welfare, the parties opposite have howled and said that we're cruel and heartless. It's total fake outrage. The true moral failure is to let people languish on benefits and not expect any better from them. That's Labour's legacy, and we saw record levels of unemployment in every age group when they last left office, particularly among young people and women. We were prepared to take those hard decisions about universal credit. I have the scars on my back from standing here defending the government's decisions at the time. But guess what? The apocalypse did not arrive. Instead, we now see record numbers of people in work, record numbers, including record numbers of women and record numbers of women over 50. And government analysis has consistently shown that universal credit is having a positive impact on labour market participation for all groups, including single parents and other vulnerable groups who face the most barriers returning to work. The government has listened to a lot of the issues involved with the rollout of an incredibly complicated system, and the evidence speaks for itself. It has helped more people get into work, and work is always the best route out of poverty. Now, before I move on, I would like to make a few comments about mental health conditions. We do see a category of people in our country who are economically inactive. And this is very sad to me and many of us, because these people fundamentally are not free. They're dependent on the state. And my concern is that the number of working age adults who are out of the labour market because of long-term sickness has been rising since 2019, from around 2 million people in 2019 to about 2.5 million in the summer of 2022. And I understand that this started before the COVID pandemic. The biggest relative jump in economic inactivity due to long-term sickness is in the under 35s, whose main complaints are depression, bad nerves or anxiety. Now, Madam Deputy Speaker, I've got 2 psychology degrees. I fully understand mental illness and mental ill health. I also believe in using words precisely. I'm very alarmed, therefore, to see the conflation of the terms depression and anxiety together with bad nerves. Bad nerves? Both anxiety and depression are clinically recognised conditions. Bad nerves is not. Government statistics, following a number of questions that I've posed to the department, don't break down the number of people self-reporting under each condition. And there's no data or information on how this concept of bad nerves is defined, assessed, treated, understood or prevented as a separate condition from depression and anxiety. And this is because there can't be. Having bad nerves is a totally meaningless phrase. Nobody knows what it is. So how can people decide if they're unfit to work if they have it? I've got bad nerves standing up here in this chamber, standing up to speak. And my constituents have bad nerves when they're navigating the day-to-day challenges of juggling work and family. And the phrase itself reminds me of something out of a Good Housewife manual in the 1950s. I just don't believe, frankly, that bad nerves is a reason to be on sickness benefits. And yet figures from the Labour Force survey indicate that 1.3 million people are economically inactive due to some combination of bad nerves, anxiety and depression. So we don't know how many are off because of each condition and how many are off because of bad nerves. So I would have thought it would, when I finish my point I will, I would have thought it would be a good idea for the department and the ministers who I can see on the front bench to understand on a more granular level what conditions are preventing our constituents from getting back into work, so that we can target the taxes of our constituents who are working hard for long hours and paying into the system more efficiently and ultimately reduce the bill. I've collected many statements from many ministers on the Treasury bench over my period of time as a Member of Parliament, investing in mental health services and back-to-work services both nationally and in my constituents. In Redditch we have a brand new local mental health hub, and that is delivered by Conservative Government and Conservative Borough Council, led by the excellent Mr Matt Dormer. So, Madam Deputy Speaker, it's worth observing that a total of 2.6 million people reporting these conditions are actually in work, and that's a credit to our mission to support people back into work, which ultimately is the best way to improve their mental health. I have a concern that following the pandemic, we have seen possibly a trend to over-medicalise some of the normal ups and downs of daily life. It's almost as though it were possible to live in a state of blissful utopia, and as if there are any interruption to paradise, it's a condition requiring help. That is just not true. It is the struggle of life that defines us and builds our character. Taking away individuals' opportunity and responsibility to face their fears by overprotecting them is the worst way to develop resilience, as any parent knows. The human condition is a state, mostly, of pain and fear. If we're fortunate, we'll experience love and happiness in some small interludes, and we must appreciate those. But I want to be very clear, I don't criticise anyone who's suffering from any mental health condition. I do not, including bad nerves, whatever it is. Because if we have a poorly designed system with poor labelling, it's not people's fault if they respond to the structural incentives that we've designed. But we must not have bogus, badly defined phrases and cod psychology as a pathway to a lifetime on benefits. So I really hope the Minister can return to this in the summing up. I hesitate to agree with him definitively because I just don't have the evidence, but I strongly agree with him on my basic point that we shouldn't reach for the sort of chemical, the chemical solution. We should look at those other solutions which are clinically much better for people, including the social prescribing that he refers to. Now, I know there are many issues I could highlight in this budget which I know will be welcomed in Redditch, and I've campaigned long and hard for the Alex Hospital, and we've seen the Conservatives delivering with an £18.8 million operating complex now open, ensuring that we're making progress in cutting those waiting lists. People can get operations closer to home, enables them to get home quicker. They have more life-saving surgery closer to their homes. And I'm really glad to see the emphasis yesterday on productivity gains in the NHS, as well as pouring in money. Constituents know that healthcare is expensive and valuable. Staff time and public resources must be properly stewarded and not wasted. And yesterday there was an unexpected but very welcome, delightful announcement from the Chancellor. He announced £5 million to spend in Redditch on cultural projects. I know that that will be massively welcomed in our area, where the arts play a huge part in our local life. I'll be talking to local groups, community groups, about how we can best use that. I know that we've got plenty of potential destinations, including the Palace Theatre, Arts in Redditch, our new library complex, again boosted by government levelling up funding, and many, many more. And I'm particularly proud, looking at budget measures as well, of the record of my local council, led by Councillor Matt Dormer, who has instigated a council house building programme. What we've seen is 19 council houses delivered. Obviously, always appreciate the fact that we need to go further, but this is a really significant move, Madam Deputy Speaker, because they're the first true council houses that were built in Redditch for 29 years. And for all the years that Labour were in control, they didn't build a single council house, even though they're much needed. And I'm glad to hear from behind me, because we all know that those council houses are a route for local families to have a decent home, to put down roots, to build families, raise their families and better themselves through work. It's a platform for that life that they can build for themselves. That, of course, is the Conservative way. And ultimately, I finish by observing, as Roger Scruton reminded us, a free economy is an economy run by free beings. Free beings are responsible beings. Our plan for work is making our country a place for free and responsible people to realise their full potential. It sets out a pathway to freedom through work. It will make work pay, and I strongly welcome it, and will be backing it in the voting lobbies. Hear, hear.